Hi, we'll get started in a couple of minutes. Thank you for your patience. Hi, I'm Angela O from the Pew Charitable Trust. I work on the State Fiscal Health Project at Pew, which helps states advance data-driven decisions to build fiscally well-managed states. Thank you for attending this webinar. State policymakers and fiscal analysts face an unprecedented level of uncertainty regarding the resources that will be available to respond to the COVID-19 pandemic while maintaining current services. The budgetary impacts of the pandemic could be significant, leaving states with reduced revenue, increased expenses, and many difficult decisions to make. During this webinar, we'll provide an overview of the factors that states should consider when budget forecasting, including the spread and containment of the virus and potential economic impacts. To do this, Pew has convened several experts. Dr. Dylan George, Vice President of In-Q-Tel and former Senior Policy Advisor in the White House, will give an overview of epidemiological modeling and potential scenarios to consider. Then Dan White, Director of Public Sector Research at Moody's Analytics, will discuss how state leaders and budget forecasters can weather potential shortfalls and revise revenue forecasts in response to those scenarios. After the presentations, Don Boyd, co-director of the State and Local Government Finance Project at Rockefeller and principal of Boyd Research, will provide some remarks and moderate our Q&A session. You can submit a question at any time by clicking on the gray control panel on the right side of your screen. Once you do so, enter your query in the questions box. We ask that you please include your state. I'll now turn the time over to Dylan.
Hi, everybody. It's a pleasure to be with you today. I'm hopefully going to try to give you a very, very high level and brief overview of epidemiological modeling of COVID-19. Next slide, please. There's 4 key points that I'd really like you to walk away from this presentation with. The first one is data and analytics can help understand the pandemic and consider potential scenarios and how to respond to the outbreak. And hopefully these can be useful for you in thinking through some of the challenges that you have in anticipating revenue streams coming in. The second point is COVID-19 likely will be disruptive for months. Third is the key metrics. There are key metrics for understanding the pandemic, and hopefully we'll go over a handful of those. And if you have questions on those, be very happy to try to go into more depth. And then last, I think that just to foot stomp this idea that there needs to be a coordinator on analytics and outbreak response, something akin to weather forecasting and what we've done at a national level. Next slide. This is a very, very quick and overview of mathematical modeling. It all stems from this basic idea of an SIR model. There's a very big body of literature around this in doing it from a mathematical perspective and doing it from an applied public health perspective, but it all stems largely from this very basic model where epidemiologists and mathematicians start thinking of a population as a group of susceptibles, a group of infectious individuals, and a group of recovered or removed individuals. and then figuring out a mathematical expressions of how to move individuals or how they flow from category to category. You can see the example on the bottom left here of a system of ordinary differential equations that is used to govern that flow among the various boxes. And in the middle bottom is a very quick an instantiation of this model for a handful of parameters, and gives you the general dynamics of what this looks like. You can make these types of models very Baroque, adding very different boxes as much as you'd like, and as much as the questions that you're trying to address require, and as much as the data will bear out adding some of these boxes. Two main ideas come from this body of literature across the range of different sorts of analytics. One is this R0 idea, which is an estimate of pathogen spread, and the next concept is one of herd immunity, or a threshold effect above which you get population-wide protection going forward. And I'll talk in a little bit more depth about these two particular concepts because I think that they help understand what kinds of metrics to think about going forward. Next slide, please. Now, R0, how to measure the spread of the virus in a population. This R0 concept is the average number of secondary cases from an index case in an immunologically naive population. Or you could think of it as R, sometimes it's referred to as R effective or RT. And in those particular instances, it's when you're applying interventions or it's no longer a naive immunological population, but the concept is the same, the average number of secondary cases from an index case. And so because it's a threshold concept, above 1, you would anticipate you would see spread within the population. Below 1, you would anticipate to see decreases in the spread of the pathogen within the population. There's 3 main components to consider when thinking about this R0 concept. The first one is the probability of contact between a susceptible and an infectious individual. The second is probability of transmission given that contact. And then the last is the duration of infectiousness. Now that's really important for this idea that contact is a critical component of spread. And I think that everyone intuitively understands that now, given that we're under population-wide shelter at home or physical distancing mandates in many of the locations. Herd immunity, next slide, please. Herd immunity is a concept of, is another threshold concept above which a population has protection from unmitigated spread going forward. So you can think of it as an immunity shield. And so this modified figure from Wikipedia that I have on the right here is that the blue individuals are those that are not immunized or are immunologically naive. You have a red individual that's sick and contagious. If you insert on the top row, if you insert one of those red individuals into the population, because the infectious individuals and susceptible individuals are able to bounce around and come in contact with one another, you have unmitigated spread going broadly throughout the population. Now in the bottom row, if you have immunized individuals that are protected because they have some sort of, they've either been vaccinated or presented with the disease and mounted their own immunological response, it's harder once you insert an infectious individual into that population for them to find people that are susceptible and to transmit to them. So you have less spread going forward. So it's the probability of contact between infectious and susceptible individuals is lower when you get above herd immunity. And this is a critical concept for when we're thinking about how to protect vulnerable populations like those that are immunocompromised or cancer patients or organ transplant patients or things like that. And it definitely is worth noting here as well that the safest way to achieve herd immunity in a population is through vaccination. That is the long-term solution for infectious diseases. This herd immunity concept, like I mentioned, is a threshold concept and can be estimated based on what you see with the estimate of R0. And so the higher the R0, the more of the population you need to have immunized the lower the R0, the lower the amount of people in the population you need to have immunized. And that's the basic idea there. Next slide, please. So colleagues at the Institute for Disease Modeling in Bellevue, Washington have been doing some really good work along these lines. And so this R0 concept is very useful because you can actually look at it through time to get a sense of how a pathogen is spreading through the population. This is what the folks at the Institute for Disease Modeling did for King County in Washington State. And what you see here on the x-axis is time, and the y-axis you see the effective reproductive number through time. And there's a couple things that you can take away from this figure. First, there's declining spread that's happening in King County, Washington, and to the point where it went below the threshold of 1, and so it was the cases were declining throughout the population in that county. The other thing that to notice from this figure though too is that there is a disturbingly slight uptick in the last few estimates, and that the estimates, the uncertainty associated with those estimates have gone over the threshold as well, meaning there might be growing spread within those populations. And so the most parsimonious explanation of this particular pattern is likely that physical distancing is working to slow the spread, and that unfortunately more effort would be needed to really push the spread estimate significantly below 1. And case identification and contact tracing would be a way to do that, but that's a completely different talk at a different time. Next slide, please. One of the things that they did at the Institute for Disease Modeling is that they looked at mobility data and the change in mobility data. And what these data that are being displayed here is on the y-axis, on the x-axis you have time again, on the y-axis you have the percent change in mobility based on over 1 year over. And so if it's a negative number, it means there's less mobility today than there was a year ago. And so don't worry too much about the various lines here, but just the general trend. The general trend was decreasing, plateaued on the bottom, and then there is a slight uptick going forward. And there's which is again, is a correlation and potential explanation for why we're seeing an increased spread in the most recent estimates going forward. So this is a key metric to think about, is this how much spread you have before you hit that herd immunity threshold going forward. Next slide, please. Now, the other thing the Institute of Disease Modeling did is that, again, this is time on the x-axis. On the y-axis, they have daily COVID positive counts in King County. The black, all the dots on here are actual empirical data that are demonstrating the number of cases, and you have they've fitted the actual SIR model to what was happening in the county. And then so this jaggedness of the data too is represented by the weekend. The weekend data are reported at a lower rate, and so you don't see as many, and so that's why you get that funny little pattern. But essentially they've come up with a model that fits the data fairly well, and it allows them to think about what kinds of scenarios could happen going forward. And the thing to take away from here is, pending behavior of individuals, given that we're below the herd immunity threshold, the behavior of individuals and how much they contact or come in contact with one another and how much they're not protected when they do that will give you the it could either be going out in the community, it could hold steady, or it could increase. And it's hard to tell which ones would happen unless you have a better sense of what behaviors will be resident within that county. Next slide, please. Now, we've already talked about a handful of these, but I wanted to give one slide in terms of like key metrics to think about as going forward. I bucket them typically in 3 main categories: epidemiological metrics, hospital capacity metrics, and public health capacity metrics. The first ones we've already largely talked about in terms of death and case counts and trends. The other aspect to think about that in that bucket though too is this idea that vulnerable populations, particularly long-term healthcare facilities, if you're seeing large clusters that happen either in congregate settings like meatpacking plants or prisons and or long-term healthcare facilities, and that's where you see the bulk of those cases, as tragic as that is, it's actually epidemiologically, it's easier to actually think about how to engineer infection control in those settings and to try to stop that from happening forward, versus if you have spread that's happening broadly in the community, that would be more concerning because it's unmitigated going forward. We talked about this RT or R naught concept and how the utility of looking at that, and I gave that example of Washington County, or rather King County in Washington. Testing capacity has been discussed broadly in the media recently, though, too. And so the main idea here is if you have one county with high testing capacity, you have more confidence in the data that you receive from that county than if you have low testing capacity in another place. It's just a certainty level that allows you to believe the data that you see from those places if you have better testing capacity. Hospital capacity is a broad bucket of metrics to think about. The reason that we've done population-wide physical distancing was an effort to flatten the curve and preserve our healthcare system, and to make sure that the healthcare system was not overwhelmed, and we could provide the same standard of care to everybody coming through the door, and wouldn't have to revert to crisis standards of care in which more people would die, like we saw what happened in Wuhan and what happened in Italy. And so keeping an eye on hospitalization rates, ICU bed availability, and then the staff and stuff to support all of those going forward will be critical components to think about in terms of if we need to loosen or tighten population-wide physical distancing going forward. Those, in addition to what I've already discussed, will be critical sorts of metrics to pay attention to. And then lastly, what I've talked about in terms of hospital capacity is largely a defensive posture. If we want to go on an offensive position, having a robust public health capacity to chase down the virus within our communities, or as Tom Frieden likes to talk about it, boxing it in and pulling it out. And that's the contact tracing capacity. And the numbers of contact tracers in a particular place will give you a good sense of whether or not there's a robust capacity. And then also, as a nuance, the number of cases that are found from the tracing activity will give you a sense of is the spread happening within the capacity of public health to actually chase it down, or is it out of control and not being contained? And then lastly, isolation and quarantine services will be critical to see how effective that capacity is to actually incentivize people to go into isolation or quarantine. Next slide, please. Now, I did want to take 1 minute and mention that pandemics are not like natural disasters, and it does seem that one of the things that I've been noting in some of the commentary in the media and in talking with colleagues of mine is that people are under the impression that seemingly or implicitly under the impression that once we get past the peak and we downswing, we will be in a better place and we'll be able to transition to a recovery phase. I think that in natural disasters, this is what happens very frequently. We have an acute, discrete, rapid event, lights and sirens surge to that particular location. It brings people together. We band together in a beautiful way, and we quickly transition to recovery to bring things together. Pandemics, alternatively, though, and unfortunately, they slowly unfold over months, and that's what we're experiencing right now. And it causes a lot of disruption, which we're all painfully aware of right now. And a lot of decisions have to be made in significant uncertainty. And the one bit I wanted to point out is that we have to have a fair amount of humility as to understanding which way this will go in the future and how much of an uptick and a resurgence will happen in particular areas. But we know that if we're under the herd immunity level, and we start having more contact and the virus is present in those communities, we are going to see resurgence. That is just basic math and it's basic epidemiology. And so we need to be a little bit humble about how effective some of these mitigation strategies will be. Next slide. Lastly, I just wanted to point out, this is one of my favorite topics and one of the things that requires a lot more discussion, and I'll just briefly mention it here, is that about 50 years ago, we were pretty rubbish at forecasting weather, to the point that in 1900, a tragic hurricane wiped out Galveston in one of the worst hurricanes ever at that date in history. Since then, we've invested heavily in data technology, science, and people to become much better at weather forecasting and hurricane forecasting. And what we're seeing right now with infectious disease forecasting, we are at the very early stages of being able to do this very well. And we need to have a sustained effort to actually improve the capabilities to do this much better, like we do with hurricanes. And the analogy does break down in some capacity, but there is a marked improvement that could happen going forward if we made this a priority, and it could, and if we prioritize that that capacity to help us in future pandemics, which we know will come. Next slide. And that's it from my perspective. I'll stop right there. That's my contact information. If I can be helpful in the future, please let me know. The next few slides is a slide for acknowledgements and references, if you're interested in following up with other information, but I will stop there.
So I think that means Dan is up.
Thanks, guys. I appreciate it. Appreciate that, Dylan. Thanks for having me. I hope the folks at Pew are pleased with the turnout today. I'm going to talk to you a little bit differently. Instead of just focusing on the epidemiological assumptions around some of the scenarios, I'm going to actually talk to you through some of the economic scenarios that we've talked about with stress testing states and kind of the fiscal implications that come along with some of the things that Dylan was mentioning earlier. So before I get started, I do need to do a brief disclaimer, unfortunately. So for those of you who have seen me speak in the past, you'll remember this. So I work for Moody's Analytics, which is an entirely separate company from Moody's Investor Service. So it's important to make sure that you know that none of the things that I say today should be misconstrued as having any bearing whatsoever on past, current, or future ratings actions. Apologies if that sounds like it was written by a lawyer, because it was, but it helps to keep me out of trouble when I give talks like this. So a few things that I want to go over with you today. One is obviously the economic impacts and the economic scenarios that we're seeing, and then walk that through some of the fiscal impacts specifically for state governments and examine that in the context of the resources that states actually have to combat those shocks. If you could move to the next slide, please. Awesome. So there are two scenarios I really want to walk you through today. Obviously, there's a tremendous amount of uncertainty out there in the economy right now. I think Chairman Powell did a very good job of kind of summing that up this morning. So anytime we're at a turning point in the business cycle and there's a tremendous amount of uncertainty, it's incredibly important for states to be presenting their policymakers with options, right? So the more that we can use scenarios and scenario type of analysis within our preparation and within our policymaking abilities, that really helps policymakers to have a full view of the potential consequences of what they're doing and kind of wrap their arms around the magnitude of the challenge that stands before them. In no other instance in recent history has that been more true than today. So the two scenarios I want to walk you through are our baseline scenario, which is we'll say a moderate amount of stress, but it's only moderate relative to the severe stress that's in the S3. And then this S3 scenario, which is our severe stress scenario, has quite a bit of a difference in terms of the economic impacts. Now, what's really driving the difference between these two scenarios is the length of time that travel restrictions and business closures are out there on the economy. There's obviously a tremendous amount of uncertainty about that as well, which is why we've run several scenarios with different timing impacts. The other thing about these timing impacts is not that we're expecting the economy to go back to normal, or at least whatever that new normal is, immediately. There is some gradual kind of phasing in of opening back up the economy over time. So the S3 scenario, the baseline scenario that I want to talk to you about, that assumes that we kind of have a reopening of the economy in most states beginning towards the end of May, and by the end of June, we're more or less at what that new normal is going to look like. What that looks like in the real world is it looks like a peak jobless rate of about 13%, maybe a little bit higher than that in our latest baseline forecast. given some of the downturns, I should make sure that you know that's an average over the course of the quarter. So there might be individual months where that is obviously much higher than 13%. What that looks like from a peak to trough GDP decline is about 10%. That is really something that it's catastrophic. There's no other word for it. If you look at the peak to trough declines from previous recessions, the Great Recession, for example, only saw a peak to trough decline of about 4%. So even under, you know, the baseline kind of best case scenario, we're looking at something that's 2.5 times as large in magnitude as the Great Recession. Now, under the S3 scenario, the severe stress, this assumes that those business and travel restrictions stay on the books a little bit longer. Maybe it takes a little bit longer for us to kind of phase in the opening up of the economy. And so we don't see everything go more or less back to the new normal until we get into late July, early August. Now, in some states individually, that's not, you know, a huge stretch. But for the U.S. as a whole, we expect, again, under our baseline assumptions, to be more or less up and running by the end of June. Now, the peak jobless rate under that more severe scenario is much higher at 17%. That's averaged over the quarter. So there could be individual months that are, you know, as high as 20%. The peak to trough real GDP decline here is significant. So we're looking at a 14% decline peak to trough in GDP. The current quarter that we're in, Q2 of 2020, we're actually assuming about a 33% decline in GDP year over year, which is a number that I never thought I'd get to say out loud, to be perfectly honest with you. So not a lot of sunshine and rainbows here when we look at these economic scenarios, but they are what they are, and we're trying to manage through them as best we can. Now, they really kind of take on a new meaning, a very sobering meaning, when we translate this time of economic stress into fiscal stress. If you could go to the next slide, Grace. Now, the two things that really impact state budgets when we go through a change in the business cycle there's, on the one hand, we have spending changes. So there are increases in Medicaid spending, for example, and other social benefit payments. Grace, if you could skip to the next slide, it'll show some of that impact. There we go. Apologies, Grace, you might have gone one too far. Or no, you're right. So there's two pieces. I apologize. I have two slide decks that I'm working off of because I just did this presentation about an hour ago for somebody else. So there's two pieces of that, obviously. So there's the spending side of things, and then there is the revenue side of things. Now, from a revenue standpoint, this is where the majority of your fiscal stress, your fiscal shock is going to come from. Now, when we look at these on average, the average state is going to see somewhere between 15% and 20% of their revenues go away by the end of fiscal year 2021. Now, what I mean by go away is based on, just comparing against a baseline that is a zero kind of sum baseline. So we assume no growth in the budget other than inflation. So just to hold things constant without having to lay people off or cut back spending materially, that's the baseline we're comparing against. And it's a 15 to 20% shock for the average state through fiscal 2021. Now, those of you who have worked in and around state governments will know that there is really no such thing as the average state. And when we compare this across states and we look at the distribution is really significant. So at the very end of the distribution, we have Alaska and some of the energy states with very, very significant potential declines in their revenues. It's because obviously they tie a lot to oil and gas prices. And then on the other side of the spectrum, we have some that are much milder in terms of their economic impacts. There's really kind of three things to watch for in terms of where a certain state is going to lie on this spectrum. So states that have a high COVID exposure, states like New York, states like New Jersey, where they've had significantly higher than average exposure in terms of the number of cases of COVID-19. The second is obviously the industrial makeup of these states. So some states rely heavily on industries that are kind of seeing outsized impact as a result of COVID-19. So any state that depends a lot on tourism, international trade, or energy, as we just mentioned, they're going to see a pretty significant shock here. And then the third piece, and this is something to keep in mind as important, not only when we look at COVID-19, but when we look at some of our other stress testing exercises that we've done in the past, we can see that when we run these through our economic models, the states who have relatively volatile tax structures, so again, your energy states, but also folks who rely very heavily on very progressive personal income taxes, for example, they see a tremendous amount of volatility in their underlying tax collections relative to the economy. That's because they rely on a very small number of taxpayers with very volatile incomes, and so that results in an outsized volatility in terms of tax collection. So those are the states who are really going to see the biggest impacts of this. The states who will see less of an impact, obviously, are going to be the opposite of those, especially in terms of the industrial structure. So you see states like Pennsylvania, like Maryland, like Massachusetts up here. What we're finding in terms of the economic scenarios is that those states who rely a lot on eds and meds, so education, healthcare services, at least over the near term, tend to do much better because they're not seeing the initial layoffs, they're not seeing huge job declines, leisure hospitality areas, for example. Now, there are obviously going to be some longer-term structural issues with higher education and healthcare from a jobs perspective, but the effects of that really don't start to come into play until we go out to fiscal 22. Okay, so not all sunshine and rainbow, but the impacts of these on revenues, like nothing that we've ever, not something that we're going to forget. If you could, next slide. Awesome. And I'm going to switch over to a handset here so that you guys can hopefully hear me a little bit better. The unemployment numbers here that we're talking about really play a huge role. Talk about Medicaid employment benefit. Look at the spending side of. We're really talking about the effects of unemployment, the effects of social benefit payments on others, and so. As much as we see revenues go down during a recession, we also start to see spending increase. And so in our stress testing process, what we do is we actually use Medicaid as more or less a proxy for that to see the impacts on overall spending. And we combine those two to basically have a combined fiscal shock to see how much states will have to raise taxes or spending as a result. And what I really want to So we see there's 5 or 6 quarters significant employment issues to the future. And what that means is that Medicaid rolls and Medicaid spending are going to continue to be expanded over the near term. Yes. Hello?
I think we're having some technical difficulties. I think your line is cutting in and out a little bit.
Okay.
Okay, I think that sounds a little bit better. I'm not sure if we're just having technical difficulties. Could I have you try again and make sure we're not having any static feedback?
I'm having trouble hearing you. Apologies.
Okay, can you hear me now?
Yeah, is that better?
Yeah, I think that's a little bit better. I'm sorry. Yeah, go ahead. Thank you.
No problem. I just switched. So I switched over to computer from my cell phone. Apologies. I'm out in.
Okay, thank you.
Sometimes we have trouble.
Okay, great. Thanks, Sam.
No worries. Apologies, everyone. Sorry about that. So just to recap kind of what I was saying before, I apologize. It was breaking up a little bit. But what I really wanted to draw everyone's attention to in terms of Medicaid is that, Medicaid spending is, we found this out in the Great Recession, is a significant impact on states when we have changes in the business cycle. And it was one of the reasons why states, all states really had some trouble adjusting to the fiscal shock of the Great Recession, because they were seeing much more than the revenue declines that they were used to. And the impact of Medicaid changes was a lot more significant than it had been in the past. Now, you can look into some of our other stress testing work in the past to see kind of some of the reasons behind that. But what is important to note for this COVID-19 stress test and some of the impacts we'll see is just the sheer magnitude of the number of unemployed persons in the United States. So just to give you some context, this gray line you see across the middle of your screen, that's the peak of the Great Recession. So at the peak of the Great Recession, we had about 15 million unemployed persons in the United States. Today, we have somewhere between 25 and 30 million unemployed persons in the United States, depending on how you read some of the unemployment insurance tea leaves that have been coming out in the last few weeks. Now, the impact of that is not only that we see obviously this huge surge in demand for Medicaid spending right now, but it means that over the longer period of time, we're going to have significant residual folks who remain unemployed and really drive up that Medicaid spending. So we're basically going to see the total number of unemployed persons in the U.S. at or around that peak of the Great Recession for the next 4 or 5 quarters. And the impact of that on overall social services spending, but especially Medicaid, is going to have tremendous impacts in terms of overall state budgets. If you could scroll forward to the next one, Grace. So when we combine all of that together, we can get an overall kind of holistic fiscal shock that we expect to see for state budgets. So under the baseline forecast I talked about earlier, so think business closures, everything starts to roll off by the end of June. We would expect the average state to see about 18% of a shock in terms of their 2019 general fund revenues, just to kind of compare apples to apples across states. Under the more severe scenario, so the S3, we would expect that impact to be 23%. Again, not a number that I would have expected to ever have to use in this kind of context. Now, the good news is that states, thanks to a lot of the efforts that have been done over the last several years to get more states to stress test and to focus on their rainy day reserve funds, states have never been in better shape to withstand a relatively normal recession. Now, the bad news is that this is nowhere near a relatively normal recession. So we're looking at something 2 to 3 times the magnitude of the Great Recession in terms of GDP impacts. So what that means is that there's only 5 states that have the reserves necessary to get through that level of fiscal shock without having to raise taxes or cut spending. And that also assumes that states can use 100% of their reserves, which we know is not the case in most instances. An unprecedented number. So 21 states, if they were able to use 100% of their reserves, would have to cut spending or raise taxes by 10% or more of their budgets, even after using all of those reserves. So it's really incredible when we look at some of these numbers here. And when we look at the more severe scenario, that number actually goes even higher, and there's actually 34 states that would have to cut by 10% or more. Now, the impacts of this, other than the sheer budget impact, the economic impacts of that are incredible, because one of the reasons that the Great Recession was followed by the not so great recovery was that states and local governments spent a lot of time really trying to get their legs back underneath them after the last recession. And the impact of that really, kind of pulled on mid-wage employment in particular, but the overall economic outlook as well. If states are required to make the same level of cuts as I'm showing you here today, it would not just mean, furloughs and people losing their jobs. It would also mean, significant curtailing of the way that the government services are delivered, right? So if you could move to the next slide, we can look at what that kind of means in terms of the overall comparison of the shock versus the resources.
Hey, Dan.
Against. Yes.
Dan, sorry, it's Angela again. I think we're having some more connectivity issues.
Okay, I've run out of things to call in on. What would you suggest? Can you hear me now?
Don, can we skip to the Q&A session, and once we can get some of the issues resolved, we could go back to some of Dan's slides.
Oh, this is Don. Did you want me to go ahead and kick that off now?
Yeah, if you could.
Yeah, okay. And I'll try to watch the chat box in case you're not hearing me.
Okay, great, thank you.
So, I mean, the two important takeaways I have are that this is, you know, extraordinarily, not only extraordinarily bad, but extraordinarily uncertain still, and just highlighting the importance of stress testing and scenario analysis. Both Dylan and Dan have multiple scenarios. It's, I think, even with the skills and the models they both have, it's clear that you simply can't say this is, well, you may have to say as revenue forecasters, this is our point estimate, but realistically in your internal discussions with policymakers, it makes sense to be clear that there's a range of possible outcomes. So we'll jump into questions. You can submit a question at any time by clicking on the gray control panel on the right side of your screen. And once you do that, please you know, enter your query in the questions box. And if you could include your state also, that would be great. I'm going to kick off with one question that I think may cut across both Dylan and Dan, and it relates to people's behavior. We've seen some studies, some analyses that suggest that even before restrictions were in place, many people cut back or did social distancing or cut back their spending, and even in places that have begun to reopen, people have been making choices, in some cases at least, to not engage in anywhere near as much activity, economic activity as before. Maybe Dylan, I don't know if you would maybe just talk a little bit about the importance of human behavior in terms of their choices and how that might alter the scenarios you look at in terms of their choices.
Absolutely happy to. It's I think that's a key component, and historically within infectious disease modeling and in epidemiology, it's been well recognized that this human behavior component is critical. It's also, as you know, economic modelers appreciate as well, it's amazingly hard to model. You know, these people have their, and so there's been new techniques that are coming online to try to incorporate some of those components into the model so that you can think about that in a more rigorous way. But it's exactly right, Don, that the degree to which people actually come in contact with one another when we're below that herd immunity threshold in an unprotected way is what's going to drive some of the dynamics that we're seeing. And we're seeing early reports now that some of the countries that had started to reopen in Singapore and parts of Germany as well, they're having some challenges with thinking about rising cases. And it's all a function of that movement factor. And so how people either adhere to that, or if we can find targeted ways of doing the social distancing in a more, so we don't have to do population-wide physical distancing mandates, that could potentially relieve some of the pressure as well and allow particular areas to open up in different ways. But yeah, that behavior component is critical.
Okay. Dan, anything you know, in terms of your thinking about the, you know, how you do your models, significant risks there, either upside or downside, related to that?
Well, I think there's plenty of risks, as always, with a forecast like this. I think one of the most important things, to Dylan's point, though, is that behavior, right? Not just how people are moving around, but also consumer behavior. So even if, you know, every state in the country were to open up tomorrow and say it's okay, you can go buy whatever you want and do what economic activity you want, I think there's a significant portion of the population that would be a little weary to go out and participate in that. So even, you know, once we start to see these business closures and restrictions taken off in the coming months, it's not going to all go back to normal immediately. And so there's going to be some phasing in there. And, you know, we have in our forecast people being a little bit cautious when they start to come in, really until we see a vaccine or some kind of a long-term treatment that can be used for COVID-19. Until that point, I don't think it's going to be possible, even as part of the recovery, to really, continuously get on a path of solid, healthy economic growth.
Yeah, and Dan makes a really good point, though, too, that there's this hope that, a therapeutic or a vaccine coming online will really help change behaviors. And one thing that I would like to point out, though, too, is that my personal guess is that a therapeutic probably won't, so the exciting kind of news about remdesivir, which is an antiviral sort of that would slow the growth of viruses in individuals and that sort of thing, is going to be more useful for people in treatment and less as a preventative. And so my guess is that's not going to change people's attitudes as much as having a vaccine will. And as we saw from Tony Fauci speaking yesterday to the Senate, he was moderately hopeful that within the next 12 to 18 months, and that number still holds, that we're going to have a vaccine. But I do think that that's the key thing to cue in on, is the vaccine more than therapeutics.
Great. So we have a question from a state legislator in Nevada who's understandably concerned about tourism and asks, are there steps that a state can take to help accelerate or improve the recovery in tourism in particular, both public health policies and economic policies for either?
Well, Dylan might be able to answer some of this in more detail, but I think to his point and what we just talked about, it's not just about opening this up, but it's also about making people feel comfortable, right? Making people feel safe undertaking some of those activities. But at the same time, you have to be guaranteeing that they're still going to enjoy them, right? I think I saw somebody this morning was talking about going to Disney World, and they said, if I spend all that money to go to Disney World, I don't want somebody in the pool telling me to go spend all my time up in my room. I want to feel safe and be able to enjoy it. And so there's a kind of a thin line to walk when you talk about that from a leisure hospitality point of view, especially. And I think those are some of the areas where we see it take the longest for folks to kind of come back online and reach whatever that new normal looks like.
Okay, great. Dave, we have a couple of questions that I think go to you about whether events have passed us by or not. That is, do we, and it's really just a question, the recent unemployment data or other data, do they suggest that the baseline scenario might be a little on the low side, a little on the optimistic side now, or are you still, do you have a sense of where data is going to drive your forecast, your scenarios?
I'm sorry, say that again, Don. You broke up for a minute.
I'm sorry. Some of the data that have come out recently might be even worse, or it's just a hypothesis, even worse than the baseline scenario. And just a question as to whether recent data suggest the scenarios might be worse the next time you update them, or not.
Yeah, that's a good question. So you'll notice in the slides that I have here, I think we talk about the peak unemployment being about 13%. Last month unemployment was 14.7. Keep in mind that that's an average over the course of a quarter. So there might be individual months that are higher than that 13%. Given some of the unemployment data from last month, it was a little worse than we had been expecting in some areas. Some places it was a little better than we were expecting. I don't think that the GDP shock is going to change. I think that 10% decline peak to trough is pretty stable. However, I do think that there's a lot of risk that the jobs numbers could go a little bit higher. That in our forecast, that won't make too much of a difference from a revenue perspective. What it will make a big difference on, though, is Medicaid. So our next expected update of these numbers is going to be in June of this year when we have a bit more data to go off of. And when we do that, you can be expecting those numbers to maybe change a little bit.
Okay, great. So we have a really interesting question that came in. Does either presenter know if loosening and then retightening restrictions due to secondary outbreaks is worse than staying closed for an initially longer time? Why don't I suggest that Dylan address that first, but then Dan also.
Yeah, from an epidemiological perspective, there is a way to loosen and tighten restrictions such that you keep the cases below the threshold which would overwhelm the healthcare capacity and the healthcare system. Again, the thresholds that are there are to try to maintain the standards of care so that anybody coming in with a case would get the best standard of care possible, and you wouldn't have to be doing these tragic triage sorts of issues. And so many of the strategies are trying to think about how to preserve that standard of care. And so that's why thinking about hospital capacity or heads and beds and ICU beds in particular. And so there are scenarios and modelers that have been thinking about would a long period of time versus tightening and loosening and playing with those strategies. Mark Lipsitch at Harvard and Stephen Kistler have done some really interesting work trying to think about how to do this. The challenge is that longer periods of time obviously will have the economic impact, and so trying to optimize across economic impact versus keeping the cases low is the challenging bit here. And I think there's a combination from an epidemiological perspective that you could do it either way. It's just whether or not you can actually optimize the economic impact at the same time. And the other issue associated with this is that more than likely, when you look at the models that those folks at Harvard have put together, they're looking at it over at least 2 years until we have a vaccine, and that will probably be in this situation of loosening or tightening going forward.
Okay. Dan, anything else?
I don't know that I have a whole lot to add to that, other than I think just to echo again the kind of the sentiment, the consumer sentiment behind that. So if we were to have, for whatever reason, restrictions have to go back in place after we've loosened them, I think you'd see a greater impact in terms of consumer behavior, people feeling less safe, people feeling like they can't participate in certain economic activities until that vaccine becomes available. So I think if we have a situation like that, it really it represents a tremendous downside risk.
And in addition, I mean, Dan's comments made me think of this as well. As it was a really excellent point that how people behave or how people perceive this loosening and tightening will be critical, and whether or not they actually comply with a loosening and tightening will be something that is going to be, I think, challenging to message and challenging to orchestrate as well. And so after we go out of this loosening into a reopening phase and going back into a tightening, whether or not the population would be supportive of that is something definitely to watch as the pandemic unfolds.
Great. Dan, we have a lot of questions related to federal aid, so let me just try to organize them into one, compound question. So one is, I think, just what are you assuming about federal relief in your scenarios? Another is, how many times do you think we can expect to see federal aid packages? When might we hit the debt ceiling? And why do states, if the problem in your S3 is $200 billion, why do states say they might need $500 billion? And what shape will states be in fiscally if they do not receive additional federal aid? I realize you probably can't address all of those, but you might subset.
Thanks, Don. Yeah, that's kind of the $1 trillion question these days, is whether or not they get any additional aid from the federal government. I think they do. I think they definitely will. I think it's unlikely that we get any clear. I think it's unlikely we get any clear guidance on what that aid is eventually going to look like until at least the end of June, which is a problem for states because most states have to balance their 2020 budgets and reconcile those before the end of June. I had some discussions with a couple of our clients earlier this week in governor's offices, and the feedback I got is that most of them are just assuming that they're going to have to play the cards they're dealt up until the end of June. So I think they're looking at closing those gaps through the end of this fiscal year without additional aid. That said, I think that there will probably be, in terms of baked into our, actual baseline scenario that we look at, we're assuming somewhere on the order of magnitude of about $500 billion will go directly to states and local governments. We assume that that'll be relatively flexible and give them some ability to supplant funds for Medicaid and supplant funds for other items to give them the flexibility to balance those budgets and deal with revenue shortfalls. I don't know that we're likely to get more than that out of given the current political guidance that we've been given out of Washington. I think that's also going to be supplemented with additional funding, either for individual consumers or taxpayers and businesses as well. But again, I don't think that's going to be a very quick process. If you look at the stimulus we've received to date, it was, to their credit, DC got out those stimulus bills, in record time, and to get, $2 trillion plus worth of spending out the door in the time that they did that, they really should be commended on that. However, now that that initial kind of emergency appears to be over for most of the country, I think we could into this very long, protracted exercise. And when we get into long, protracted exercises in DC, politics has a tendency to seep in and really determine the outcome. And so I think the additional stimulus bills that we see beyond this are likely to be very political in nature in terms of how they're put together. And that means that they're going to be a lot slower, and there's going to be a lot less certainty until we get to we see the whites of its eyes as we move forward.
Okay. I know we're getting close to the end on time, but let me bring up this another question for you, Dan, but it's an attendee in Pennsylvania asks, are there common elements across states that do budget stress testing in terms of the position they may be in, or how well they're positioned to respond to shock scenarios, if that's something
Yeah, no, that's a great point, Don, and I think it's absolutely true. So when we look at the states who are actively going out and stress testing their budgets every year, they are better positioned on average than any other states to really run into this kind of a downturn. And I think a great example of that, there's some really good examples, but like Utah, Minnesota, Maine, states who have really kind of institutionalized their stress testing into their budget processes are, right at the top of the list in terms of states that are well prepared for this and any other downturn. Another really great example is the state of California. Now, if we were to go back in time 12 years, you'd see that California was really, a poster child for not being super well prepared for a recession. They had to make some of the largest fiscal changes of any state during and after the Great Recession. However, when we go 12 years later, they've got a massive rainy day reserve fund that they've been slowly building up over the last decade plus. And even though they have a lot of COVID exposure and they have a very volatile tax structure, they're in much better shape than similar states in similar positions like New York or New Jersey, who are going to have to make absolutely crippling budget cuts in order to get through this. So stress testing works, and we're seeing that in terms of the results, in terms of who's prepared going into this and the level of fiscal changes that states are going to have to make over the next 2 years.
Great. Quick one for Dylan. Dylan, is there anything more you can say about, kind of how you see patterns across the country being likely to kind of evolve over time in terms of, which kinds of communities might be most or least at risk, urban, rural, regions of the country, where the risks might be greatest and why?
Yeah, no, that's a great question. And I think that there's different risks in different locations. I think in high urban density areas, density works against them in terms of higher contact rates, and therefore you're going to see exponential growth if physical distancing is relaxed and other mitigation strategies are not put into place, as long as we're below this herd immunity threshold. And we've seen from serological evidence that they did in New York State and New York City in particular, they came back with an estimate of about 20% of the people had been infected, which is well below the 50 to 60% needed to get to that herd immunity level. So you're going to see in those urban areas, you're going to see probably much more explosive growth and much more concern about growth. But you also, as we all know, that they have that much more access to healthcare facilities and resources than you do in rural settings. And so while you would anticipate spread to be slower in rural settings, what we've seen in some of the Dakotas and even in rural settings in Maryland and Virginia with congregate settings where there's meatpacking plants or other sorts of places, those are going to be high risk engagement areas. And so I think the risks are exactly right, are going to be different in different locations. And figuring out how to mitigate those risks will be challenging. And then the last bit I would throw on there too is this idea of knowing that you have few cases in some rural settings is really dependent on the degree to which you have testing capacity in those rural settings. And if you have good testing capacity in some of those places where you have low numbers, you can have confidence that there's less spread or less pathogen in those places. But if you don't have good testing capacity in those places, there's significantly more uncertainty.
Great. I'd like to check in with Angela. We got lots of great questions still, but it's 3 o'clock. So two things, Angela, I of course can ask more if you want. The other thing I wanted to point out is there are lots of questions. People want these great slides and access to recordings, et cetera, and I'm sure you can answer that better than me. Anyway, I'll wait to hear what you say.
Thanks, Don. Just in the interest of time, if we could wrap up, but if there's any follow-up questions, I can coordinate with the panelists to see what we could do in the future of maybe a future webinar, or if that would just be individual outreach. So I just want to thank everyone again for their interest in this webinar, and to our panelists, Dan, Don, and Dylan. Please note that you'll receive a survey about the webinar. If you could respond to it, we would greatly appreciate that. A recording of the webinar and the material will be posted to our website at pewtrust.org. And my contact information is on the screen if you have any follow-up. Thank you. Have a great day.
Okay, thanks.